Test will be looking for a flare, either an inflare or an outflare. So I'm back to my landmarks again. Again, the pressure is enough to blanch the fingernail. So you can see this is kind of just resting on the skin, and this is the amount of pressure that I used. And the reason we have to do that is because I have to get far enough in so that I'm under the PSIS, so when the PSIS move, it'll move my thumb. If I'm on the skin, then as she moves, it'll just roll on the skin. It won't give us a measurement. Okay, so you're gonna put your right foot 4 inches forward and 4 inches out. Perfect. And what you're gonna do now is you're going to feel for, you're going to rotate your toes in and rotate them out. And what I'm feeling for is the movement of the ilium. So as she rotates in, it should go that way, and as she rotates out in external rotation, the sacrum should outflare. So inflare, outflare. And so as she does that, I'm feeling it move back, and I'm feeling it move forward. One of the things is don't be too low, because if you're on the acetabular femoral joint, you're gonna think it's moving, but it's really just acetabular femoral joint. Okay, and so let's try the other leg. So that felt okay. So as she goes in, I'm feeling whether the ASIS is rotating in. That's what we're feeling. And as she comes out, I'm feeling whether the PSIS comes back in. So external rotation, we're focusing on the PSIS. Internal rotation, we're focusing on the ASIS from a palpation standpoint. Doesn't move back, does move forward. Let's try the right one again. A little bit too far forward there. Yeah, perfect. In, good. Out, not so good. So very similar bilateral. This one doesn't move posterior as well. So she's kind of got an inflare, meaning that she can go in, but she can't go out. So that's our motion testing. And so now we'll talk about the results of what we would do with that motion testing. So let's pause that.